Hi, I'm Dr. Marty Becker, America's veterinarian, and also the founder of Fear Free. I was born and raised in southern Idaho and now live in northern Idaho and practice in Sandpoint, Idaho at North Idaho Animal Hospital. When I was there, I worked with my daughter, trainer, and co-author, Mikkel Becker.
Thanks, Dad. Hi, I'm Mikkel, and I am so excited to be talking with you about how to find a trainer to work with in your practice. And there are a lot of things to look for to find a good trainer and how to separate the good from the not so great, and ways that you can incorporate training services into your veterinary hospital.
Can you imagine as a veterinarian or a veterinary nurse or member of the healthcare team, you suddenly discovered something that was killing pets in your zip code, in your county, in your state, across the country. In fact, it was the #1 killer of pets. And many of you already know the answer to that is behavior problems, which affect more dogs and cats than any other medical condition and are one of the most common causes of euthanasia, relinquishment, or abandonment. Actually, they are the #1 cause. Believe this, 96% of surrender dogs have never had obedience training. And 65% of relinquishing owners said a behavior problem was a contributing factor to surrender. And as it is with humans, the pet is sexually mature before they reach social maturity. So often in that critical first phase when they get a pet, the pet might have reached its full adult size but is having behavior problems, and the kind of behavior problems that end up with them being euthanized, relinquished, or abandoned. One of the worst things we always see, a pet that was welcomed into the heart and homes has a chance to integrate with the human family and is now put outside. The cat's put outside, the dog is chained up. And not only is this, I guess the loss of the pet certainly would be the most serious thing, but also there's a financial impact on the veterinary hospital. It's estimated that about 15% of a veterinarian's clients are lost annually due to pet behavior issues. Again, this can be due to relinquishment, rehoming, or euthanasia. A veterinary hospital loses 15% of its clients. On average, that's 450 patients per year at an average of $505 per pet. That's $227,250 per year. So early intervention and preventive behavior services will likely increase pet retention and decrease financial loss due to unresolved behavior concerns. And despite the importance of veterinary involvement in behavior, many are uninvolved or distanced from behavior and training efforts and intervention. For many veterinarians, it's out of their comfort zone to do behavior. In fact, in a study, 49% of veterinary respondents felt unprepared to handle behavior. Now, here's an interesting thing. Let's say there was a new condition that came up, a new disease in a dog. You'd study it. You'd listen to experts at different symposium or conferences. You'd read journals about it. You'd want to learn everything there was to be able to accurately, have the education and the training to accurately talk about it, prevent it when possible, or treat it when not. And you have to think about behavior. Behavior produces a physiologic response, so behavior is medicine. And the behavioral management of dogs and cats is now recognized as an essential component of primary companion animal health. And this is from the 2015 AHA Canine and Feline Behavior Management Guidelines. And as you well know, AHA is who we look for to vaccine guidelines, fluid guidelines, pain guidelines. So if you have an adopted dog and it attended training, so you actually hook them up with a trainer and make sure that that trainer is an allied part of the healthcare team, they're 2.63 times more likely to stay in the adoptive home. And a training curriculum could substantially reduce the return rate to the shelter or something to be rehomed. And one of the issues we see a lot in the veterinary hospital is the pet owner is scolding the pet, is using inaccurate training methods, and this results in more aggression at the veterinary hospital. So veterinarians can play a leading role in behavior management. The veterinarian is the true pet health expert. And this is an important point to make. Health and behavior are interrelated. Health affects behavior, and behavior affects health. The two cannot be separated. And who else besides the veterinary professional are in the ideal position to educate clients about potential behavior problems and risk factor? So where do you get started? Each healthcare exam, every time you open that exam room door and go inside, you should include an evaluation of the pet's behavior. You want to make sure we address behavior problems early and often. We want to allow for early intervention. And also, behavior changes are often the first presenting signs of a disease. For example, a pet that never bit before may be biting or be noise sensitive. It may actually be related to some condition that has caused untreated or undertreated pain. And as you know from Fear Free, preventing and alleviating fear, anxiety, and stress is a medical need. We want to look at a pet's physical well-being, and we want to look at a pet's emotional being, because excessive and prolonged stress negatively affects the body and behavior. Excess stress can lead to signs of sickness. Healthy cats and chronically ill cats with feline interstitial cystitis are just as likely to show sickness behaviors when stressed. And you want to address stress by enriching the environment, which is improved health and behavior. Tony Buffington, the feline guru, is probably the most well-known veterinarian in the world when it comes to enrichment, says you get the environment right and they'll recover. So we provide physical well-being, emotional well-being. We provide quality, complete behavior support for pets. And just as a primary doctor works with and refers to outside healthcare professionals, including medical specialists, mental health counselors, and life coaching, so too can the veterinarian refer to a veterinary behaviorist, a certified applied animal behaviorist, an associate applied animal behaviorist, a certified trainer, or certified behavior counselor. It's only recently that the veterinary profession has understood our obligation to provide behavioral support and recommendations to trainer. Most owners are completely unaware that there are actually boarded veterinary behaviorists. By the way, the American College of Veterinary Behavior, there's under 80 in the entire world. And if the trainer referral doesn't resolve the issue, the owner may have exhausted resources and tolerance. We need to do those extra steps to connect pet owners with boarded behaviorists. Now, Mikkel, we know that not all trainers are created equal, that there's a large lack of requirements, regulation, and oversight of trainers, that training is an unregulated field, and unskilled, poorly schooled trainers may cause harm. It's so easy for somebody to read a book or get a pet and teach it a few tricks. I'm being just a little sarcastic here, and then they call themselves a trainer. Or somebody goes into a pet store assuming that that trainer has the education, the training, and the experience, and is somebody that a veterinarian would recommend. How can you choose a trainer to work with your hospital?
Well, that brings up a lot of really great points, and there are definitely things that you can look at to separate those trainers that really are qualified versus those that definitely don't have the education and the background that really is critical and so needed, because really we're playing with animals' lives here, and the wrong type of training can be absolutely damaging for that animal, but the right type of training can make all the difference in that pet's life. Some things to look for in a trainer, just as an overview, which we will go more in depth on this, is you want to look at a trainer who is certified or has an educational background through a really credible organization. You want to look at a trainer that uses humane training methods, which we'll talk more about. You want to have a trainer who is insured. You want to have a trainer who comes recommended and is referred. It's important to have personal experience and knowledge of the trainer and the type of methods that they actually use. So not just hearing that they use positive training methods, but to actually see it in action. You want to be able to have a trainer who's able to partner well with your hospital and who works well with people, not just works well with animals. So how do you narrow down that search to find that really great trainer? Looking online can be a great place to start. You can look on websites, you can look on blogs, you can look through social media. So searching by a trainer in your area, and this can just be through a Google search to get that initial hit to find that trainer, and then really looking them up. Look to see if they have any video channels on YouTube. Look to see if they have any Instagram or Facebook postings. Really look at their blog posting and on their website and look at pictures and see those videos to really see if what they're doing and what they're teaching is something that you feel is fear-free friendly and is emotionally protective for that animal. You can also do a listed search of the certifications and educational programs. So for instance, through the Karen Pryor Academy or IAABC or the Animal Behavior College or the Victoria Stilwell trainers, you can go ahead and search on their site by zip code to find trainers near you who are already certified through that organization. And that can be a really great starting point. When you look at the type of organization or certification that a trainer should have, not all certifications or educational programs that trainers have gone through are created equal either. And Marty, I know that you have some words on this specifically because we dealt with this when we were looking at the Fear-Free Animal Trainer certification.
Well, we did the work for you, basically. It's almost like if you have a pet owner that goes into a pet store or a grocery store and they can't look through the tantalizing ads and competing claims to make an informed decision on what food is best for their pet. It's only in the recent years, looking through Fear-Free, that I myself have taken the time to interact with boarded veterinary behaviorists and some of the top trainers in the country and animal handlers. And we took time to narrow down, and many of the listed certifications and educational programs listed as a prerequisite for the Fear-Free Animal Trainer have searchable directories of graduates and professionals with certification on their sites. So when you go to fearfreepets.com or fearfreehappyhomes.com, you'll be able to look at the organizations that we have given the seal of approval to, and then go to their databases to search for people that are in your area. You want to make sure you look for a trainer who is certified by an overseen organization that's rooted in reward-based positive training methods. Hear that again, reward-based positive training methods. No more flooding pets to get them to submit to your will, shock collars, prong collars, the abusive things that may produce an instant result, but far damaging in the future. And to be eligible for the course, they must have a baseline certification or education from a qualifying educational organization as well as pass the intake test. It's almost like an alphabet soup or a Scrabble game of all these different groups. There's ABC, ABDT, CPDT, IABC, ABC, IABC, Karen Pryor, Pat Miller, Gene Donaldson. Just know that we've worked with hundreds of experts to self-select these group of people that you can feel confident if they are a member in good standing of these organizations, they've gone through Fear-Free certification and can provide proof of insurance, you're well on your way to finding somebody that's got an allied part of the healthcare team. Unfortunately, if you're looking on your own, credentials don't guarantee the use of humane methods or honest marketing. So you need to make sure you don't just look at what you see on their website or take somebody else's recommendations for granted, but you actually see how that they teach pets. Just know that punitive force-based training methods are not compatible with Fear-Free. Quick fixes with punishment are to the animal's long-term detriment.
Absolutely. You bring up some really great points because a lot of times with compulsive force-based training, it's addressing the symptoms of the problem without actually addressing the root cause. And in doing so, it's actually exacerbating the underlying issue in most cases, causing more anxiety, more fear, more stress, which actually increase. What we want to do instead is just like with Fear-Free, when the animal's coming in and they're stressed, they're anxious, they're fearful, and we're looking at changing their baseline emotional state into something that's positive, where they have that happy expectation, we want to do the same thing with training. We want that animal to feel relaxed and comfortable and happy. And in doing so, it really comes down to a trainer working alongside the veterinary team, working with the veterinary behaviorist in a lot of cases as well. And really with that partnership and that teamwork approach, that's really where we're able to help pets to the fullest.
And just stating that the training user rewards isn't enough. We do rewards in our training. Beware of the balanced trainer that mixes punishment, rewards, and training. Many rewards are conflicting in and of themselves. For example, petting the dog's head once they sit after having their collar tightened until they did so. Aversive methods can increase conflict, uncertainty, and FAS, even with mixed with rewards. It's important for trainers to abide by emotionally protective, humane, reward-based positive training methods that complement the veterinary's team care for patient health and well-being. Now, how are you going to find this out? You need to investigate the trainer first. In addition to initial searches like we talked about online, getting recommendations people, you need to gain a personal knowledge of the trainer and their methods by watching the trainer in action with pets and people. Here's a few ideas on how you can do that. You can have individual instruction. You might provide a lunch and learn and a demo with one of the staff's dog or the veterinarian's dog. I actually prefer that over the trainer's own dog. I've learned that from my daughter, Mikkel. Have a staff member or other person knowledgeable in Fear-Free take the class or have private instructions. Trainers may offer free enrollment to veterinary team members or allow observers in class or the private training, and if they're willing to allow an open door policy to come at any time and watch, that's a good sign. Request a videotape or look at online videos, but be careful there because sometimes they'll just put up the things that are their success stories. And one of the things to do is to observe the body language of animals in class and private training and how the animals react to the trainer. Again, you're now trained through Fear Free to look for signs of fear, anxiety, and stress. It doesn't matter if the pet is going in for an examination, vaccinations, nail tim, blood draw, procedure, boarding. We know the signs of fear, anxiety, and stress. It's the same thing with training. The pet's either happy and calm, alert and involved, or it has fear, anxiety, and stress. Mikkel, I know you have a lot of things you talk about, red light, green light for different areas of training. Can you expand on that?
Absolutely. So when that trainer is doing that individual instruction, or when you're shadowing a class or taking a pet through that trainer's class, some things to look for as far as green lights, which would be those desirable things we want to see in that trainer and in the way that they interact with people and animals, versus the red light and the things that we want to avoid and see as big red flags to kind of steer clear of that person. We're going to go ahead and go through those. So body language, as you mentioned, is a really big one. We do want to see those animals looking happy and relaxed, and you can even see that in pictures, but definitely in video and live with those animals in classes or in individual training. And in some cases, there may be animals that display FAS, but what really it comes down to is what does that trainer do about those signs of FAS? If the trainer just forges through that FAS, ignores it, and actually in some cases when it's compulsive training, a lot of times that's looked at as desirable when the animal's shutting down, cowering. They go from barking to all of a sudden that state of learned helplessness when they've been punished. In some cases, that's a big red flag when that trainer thinks that, hey, that's a good sign. Definitely, we do not want to see that calm submissive state, unfortunately, as it's been called on some major TV show. We don't want to see that calm submissive state as it's been called on that show, because those animals are absolutely petrified and in that state of just shut down, that emotional shutdown. Instead, what we want to see is when that trainer does recognize signs of FAS, we want to see them adjust their approach and adjust the situation for that animal's comfort. Not every dog is a great dog to have in training class. It can be too stressful for a lot of animals. So for those animals when it is too stressful, looking at how does that trainer adjust their approach, and maybe they modify the environment in certain ways where that dog has a little bit more space, or they're behind a gate, or maybe they're doing individual instruction, and also looking at if that trainer is able to partner with that veterinary team and be able to refer those patients who are showing those extreme signs of FAS. Another thing to look at is the trainer's understanding of animal learning and behavior. So a green light is when the trainer teaches owners to better understand their animals through scientifically based understanding of animal behavior and learning theory. And this can include things like the importance of teaching and rewarding those right behaviors when they happen. The more we reward that right behavior with things that the dog enjoys, the more that we're going to see that right behavior occur. And they can also do things like talking about the importance of taking proper physical care of animals, and this includes the importance of enrichment. When we hear trainers talk about things like using food puzzles, for instance, that's a really good sign and something that we really want to see. A red light can be the trainer who relies upon concepts like pack theory and dominance, or being the alpha dog. Those are big red flags to steer clear of. We also want to look at how that trainer communicates with people. So it's not just training the animal, actually more so it's actually training the people. And so we want to look at how do they connect with people. We want to have a trainer who really relates well to others, a trainer who's very patient and understanding and empathetic. Training is really hard. Even as a trainer, sometimes we can get frustrated or things don't always go as planned. We want to have a trainer who's empathetic and understanding of that and can calmly guide and reinforce owners in going in the right direction. So we want positive reinforcement not only for the animals but for the people as well, where that trainer is really encouraging and understanding but also helps to really motivate them in the right way. We also want a trainer who uses clear communication, and I like it when a trainer can really make it easy for that person to understand and easy to implement. So it's something that that person actually can implement at home and keep on doing at home. What we don't want is the trainer who says this is something only the trainer can do, just like you may see on the warnings that don't try this at home. That's not the type of trainer that we want. We want training to be we want training to be friendly and fun and good for the entire family. So we want the type of methods that the entire family can use. So because what you see a lot of times is whatever the parents do, the kids are going to do as well. And so we want that training that's protective and is really healthy for the animal and for the entire family. You also want to steer clear of trainers who use harsh language with people or are very judgmental. And unfortunately, you will see that in some circumstances because really, again, this is going to be a trainer who's going to be representing you and your hospital as well. And so you want them to be very friendly and communicative in a good way. Also, when we look at equipment, green lights that you would want to see in terms of equipment, you want to see a trainer who has the animal in harnesses. And a front clip harness, for instance, can be a really great tool, or even a back clip harness can be a tool that a trainer may use. Flat collar, so just a regular buckle collar can be a good type of equipment that a trainer might use. Head halters, trainers may use these, or they may use harnesses that have multiple attachments, maybe one on the back and in the front. And a lot of times with a reward-based trainer, you'll see tools like clickers or treat pouches. You'll see them using toys, lots and lots of good things that the animal likes. And they may use things like long line, so a longer leash that they can do recalls on, for instance, where they have the dog come and call or they do their stay on. Some red light types of equipment that you don't want to see would be a correction collar. So any collar that causes pain to that animal. So this can be a choke chain, a prong collar, shock collars, and spray collars. Those are all big red lights and not the type of equipment we want to have clients using. So you also want to look at how does that trainer teach new behaviors. So some green light ways that we want to see the trainer being able to teach new behaviors would be by using methods that are safe emotionally and physically for the animal and that are family friendly. We want to see them using positive reinforcement, where they're using lots of rewards to train and to motivate that animal. And a lot of times they're building behavior slowly. So it's just like in those little baby step-like fashion where they're moving at the pet's pace and moving at a pace that the animal is relaxed and comfortable with. You also want to see that that trainer has a working knowledge of behavior modification, where they are able to build those positive emotional associations as they're doing the training. They may use methods like classical conditioning, classical counter conditioning, and desensitization. A red light would be when a trainer really motivates animals with punitive force-based methods. So this is when they may stop or release pressure, pain, or another negative like shock, or they may let go of the choke chain when the animal does what it is that they are looking for the animal to do, such as going to that sit or going to that down. Or in some cases, if they're using a shock collar, they may stop the shock when the animal does what they want, such as coming towards that owner. Those are all big, big no-nos that we do not want to see and that can cause a lot of conflict and actually increase, they can rise the rate of aggression in that animal. Don't want to see any of those. We want to see the animal happy and relaxed and wanting to work for what it is that that trainer is using to motivate that animal. So you also want to look at how does the trainer respond to unwanted behavior. A green light is when a trainer uses management skills. So this is when a trainer may use a head halter, a front clip harness perhaps, to decrease that unwanted pulling on leash. They may use things like baby gates or avoiding the situation altogether. So you want to look at the trainer trying to keep that dog from going in over their head where they have that tendency to react or to do that unwanted behavior. And what you want to see is you want to see that trainer slowly building up to that situation, giving that dog the ability and the tools to be able to react differently in that situation. And this can be also rewarding an alternative behavior in place of that unwanted behavior. So instead of the dog jumping up, for instance, the trainer may teach that dog to sit. Or when that dog sees another dog coming towards them on leash, rather than that animal's tendency to get really stiff or maybe start to get to the point where they may be reactive, that dog can be taught to turn and move away with the owner or to turn in a sit and look up towards that owner, for instance. And also that trainer may teach redirection. So perhaps the owner is taught to redirect the animal away from the unwanted behavior by giving them another outlet or another behavior that they can be rewarded for instead. So some red lights for how a trainer responds to unwanted behavior is that they add an aversive to get the unwanted behavior to stop. This can include things like jerking the leash, giving collar pops where they jerk the collar, spraying the animal, throwing things at the dog, or causing something that scares the animal, such as the can of rocks to get that dog to stop with their barking, using shock, using physical punishment and pain, yelling, scolding, in any way intimidating that animal. So if that person challenges or tries to intimidate the animal with things like an alpha role, holding the dog down, stare downs, or any other attempt to dominate or to be the alpha, or forcing that animal to do something, those are all things that we want to avoid in a trainer. You also want to avoid trainers who offer guarantees. So if they say, we guarantee that your dog will do this, we guarantee that your dog will stop barking, those are really unethical statements for a trainer to make.
You know, Raquel, when I was listening to you, I think of in all our travels, you see a parent that is very aggressive and intimidating and alpha with the child. And I think all of us that are parents or grandparents or have nephews and nieces know that there's a good likelihood of a negative outcome. A child that ends up aggressive or using force to get their way. And instead, you like people that use positive reward-based training with children. So we're already doing it there, but our knowledge of working with trainers has been so limited in the past. So we've helped you out with Fear Free. We've partnered with the boarded behaviorists, the experts in animal cognition around the world, the animal handling experts, not only in veterinary medicine and training, but in the zoo world. So we've found the organizations that we can recommend to you without reservation. Once you've found somebody from these groups, somebody in your area, search by zip code, who's in your area that's a member in good standing, they've gone through the fear-free certification training, now you have to interview them. Yes, you're going to have to interview them. So you want to investigate and uncover who the trainer is and their fit by considering the following during interviews. One, you need to inquire about insurance, and trainers should be insured. Two is to get references. Ask the trainer for a list of references of those they've worked with or those who have working knowledge of their training. Hopefully other veterinary professionals, trainers, pet owners, rescues are a good place to start looking. Good questions to ask are the training tools and methods used. And it's important to kind of dig deep to find the real training that's taken place. And you can ask explicitly what tools are used or not used. Do you use shock collar? Do you use prong collars? The answer should be unequivocally no. But be aware that clever marketing may be deceptive and betray much of the real training that takes place. Somebody will say they're positive reward-based training, but you watch your videos and you see a shock collar or a prong collar or a short collar being used. So I'm going to go through this 10 lists of good questions to ask. One is about the training tools and methods used. Two is what species are they comfortable working with? Is it just dogs or can they work with birds and cats and other things? What are their sensitivities? You know, not all trainers are comfortable working with the hospital setting. Their availabilities. What hours and days can they work? What other commitments do they have? The expected compensation thing, do they want to charge to the practice or run it as an independent contractor? The trainer expectations from the hospitals, it might be for referrals or space or where they can hold classes. Number 7, have they signed or would they sign the Fear-Free Pledge? And this is something we really want to insist upon, that the Fear-Free training, they can fully integrate within the Fear-Free that's in the hospital. Number 8 is an understanding of health and behavior connections. So want the trainer's knowledge of behavior and how that interfaces with health. Also ask about the familiarity of working with veterinary professionals. And offer some scenarios. For example, an older dog suddenly started peeing in the house. What would the trainer advise? A cat had been using the litter box but stopped using the litter box. What would the trainer advise? Find trainers who partner well with and refer appropriately to the veterinary team and who respect the limitations of the trainer. Look for the trainer's understanding of the link between animal health and behavior and their knowledge and willingness of partnering with the veterinary team. Ask about familiarity and understanding of working with and referring to veterinarians and other behavior professionals. One thing that we want to insist upon with trainers, and that is the diagnosis and medical intervention remain in the purview of the veterinarian. The Fear-Free animal trainer and other training professionals are not to diagnose medical conditions or to advise treatment or any type of medication or dosages. While it's a prerequisite to belong to one of the organizations that we have listed and done all the legwork to basically diagnose if they're worthy of you working with, we hope that they would have signed the Fear-Free Pledge, and this is something that you might recommend to them to further integrate them within the Fear-Free that's practiced in the hospital.
So the certification list that you have as a resource, this really is a great starting point, and not all trainers will have gone through Fear-Free yet or have gone through the Fear-Free animal training course. But that really is something to look at for the future for that trainer, and it would be a really great investment to really get the trainer on the same page with your hospital. And in that course, they'll learn a lot of things like how to really work with the veterinary team, how to do victory visits, and really being able to recognize the signs of FAS and to be able to communicate it in a way that your hospital team already uses with the different FAS levels. So that's something that's really advisable, is to go through the Fear-Free certification course, or especially the Fear-Free animal trainer course, but definitely having at least one of those prerequisites of that educational course or certification is a really good base to start from. And just having a trainer that already has that certification, you can start to integrate their services within your clinic, and especially once they go through some Fear-Free certification, really start to integrate them more into your work with Fear-Free and their work in helping your clients with that. So one thing to think about with trainers is a lot of trainers, they don't really have that medical background, and it can be a little bit alarming for a lot of trainers to go into the veterinary hospital and to go into the back and all of a sudden to see an animal that's on the surgery table or is having a procedure. That can be a little bit shocking for someone that hasn't grown up in that. I had the unique perspective of growing up with my dad as a vet, where that stuff just seems so normal to me, but it's not normal for a lot of people and not for a lot of trainers. That's something to be aware of and to talk with the trainer about. One thing that can be really helpful is to really give the trainer an idea of how your veterinary hospital works, what it's like on a day-to-day basis in your clinic. And one of the things we have in the Fear-Free Animal Trainer certification is to actually have that trainer have a certain number of hours in the veterinary hospital before they gain their certification. And that's really important for trainers to really have an understanding of how the veterinary clinic works and how your team works. Because a lot of times I think it's a surprise to people to realize how short your time is with clients in that exam room. And so really helping that trainer to make it realistic on how they work with animals and really what the expectations should be for a victory visit, for instance, or how to help that animal be calm for that exam. Another thing you might want to think about is if you're just going to have one trainer, or in a lot of clinics, you may think about having multiple trainers. A lot of times trainers have certain specialties, things that they're really interested in. So for instance, one trainer may love doing puppy classes, whereas another really enjoys things like doing trick classes and more of that advanced training, and maybe the canine good citizen training. So you can find multiple trainers, or one trainer that maybe is really happy and motivated to do all of it. And really looking at, where do we start with this? So it can seem really overwhelming and kind of just like a lot to go all the way into it from the very, very start. A good thing that you could do from the very start may be just having a puppy class, having a basic manners class, and also working on the victory visit training. So this might be when you have the client come in, perhaps once a week you have that trainer scheduled for a few hours, and you can go ahead and block out that amount of time and schedule different clients with that trainer. Really, you can do 15-minute sessions to 30-minute sessions. A lot of times those dogs learn better within those shorter sessions. And so you can set up things like that, and also set up the scheduling for your puppy classes or the different classes that you might have, such as kitten classes. A lot of puppy trainers may be very interested in doing kitten classes. There are a lot of similarities between the two, and that might be another great service you can offer to rescues and to your clients as well. And also think about scheduling. If this is something you want to have online, if this is something you want the receptionist to schedule, or something that you want the trainer to schedule. The way that training looks in your hospital will definitely differ by the hospital and by the trainer. Some things to think about would be if that trainer is actually an employee of your hospital, or if they're a private contractor, a private business that's run out of there. You can think about ways to incentivize that trainer and also make it worthwhile for your hospital. So potentially, in some cases, that the hospital may take a certain percentage of the fee for a puppy class, or in other cases, it may just be a service that's offered to their clients that really helps to bond the clients to the hospital, where the puppy class fees go directly to that trainer. It really depends upon the hospital itself, or potentially the hospital pays the trainer directly. You also want to talk with the trainer about also sending training reports. Training reports are really helpful and gives you a really good idea of the dog or cat's progress. So say that they've been working with an animal that you've been working with as well, and you have a behavior modification plan that trainer is helping to fulfill, having that training report is really essential. And we have a resource here on ways that you can help that trainer to be able to give you that training report that can be beneficial to your hospital. And you may also include details in that animal's emotional medical record. So this really is a learning process, and this is a time to really grow with the trainers that you work with. Now, this might be something that starts out small and grows into something that's really big within your clinic. And a lot of clinics that I've worked with have really found that this is a really great revenue source. And so with training classes for puppies, this might be something that you actually integrate into your puppy packages. At Advanced Care Animal Clinic, this is something that we've been exploring with how to really market the puppy classes and make it something that pet owners are aware of and they recognize the value and want to invest in this. And this is something that the veterinarians talk with directly in the exam room with the clients when they bring in their puppies, the importance of socialization, talking to them about training, and also having that resource right there in the clinic to be able to do those individual lessons and to be able to do those puppy classes. That's just invaluable to that client and really makes it easy for them. Rather than having to do that extra step to find that trainer, having them right there in the clinic, it's been really amazing for their clinic itself. Some things to think about as far as client feedback. You can do surveys after classes. So getting a survey and having different things that the client can put down, maybe a scale from 1 to 5. What did they enjoy the class? What would be some things you would hope to improve in the future? What was your favorite part about class? Any advice or any feedback that they might have that we can use to improve our classes? I found that to be really, really helpful. And that was something I did when I first started out classes at North Idaho Animal Hospital, where my dad is a veterinarian at. And having that client feedback was really helpful and really helping to shape our classes into something that was valuable for that client. You can also consider selling training and enrichment supplies right there in the hospital. And this can be things like having treat bags, having the treat supply that they may use during victory visits or during classes, having food puzzles right there on hand, head halters, different harnesses that animal might use. That can be really helpful and also be an additional revenue source for your hospital. So you have a trainer now that's going to be working with your hospital. How do you market the trainer? How do you market their services? There are a lot of different ways. Some things to think about may be doing some social media features, having a meet the trainer time where they really get to know that trainer and where they get to ask questions. Having things like structured fun visits with trainer oversight so that the clients may be going through some fun visits and the trainer may be just giving some little free tips to that trainer, to that person as they're going through, such as getting their dog on the scale. That's something we've done at Doggy Haven Resort, is to really work with different veterinary hospitals where we will do victory visit workshops. And just by working with the clients, helping them with little things in the exam room, helping them in the lobby with helping their pet to settle, helping their dog to willingly get on the scale. We've gotten a lot of clients that way, and it's been really a valuable service to that hospital as well. You can also think about having different things like those puppy class flyers, or actually having the puppy class signs right when they come in the hospital, having it right there in the exam room, having it be an optional part of a puppy package. So thinking of ways to just make it easy for them to want to invest in their pet's training. And when it's veterinary recommended, that's absolutely essential. So the more that we can talk about it and the more that we can be excited and really understand that value, that's absolutely essential. And I know that's something my dad, Marty, is really great about.
I think the key is what Mikkel said, the veterinary recommendation. It is actually a prescription, just like you would prescribe a certain kind of food that they should feed, a certain kind of parasite control product, a certain vaccine line. Actually prescribe a trainer so that we can, again, every time we have an office visit, we should be asking, are there any behaviors in your pet you would like to improve? If you say, are you having any behavior problems, it'd be like saying the same thing in your children. People will go, no. Are there any behaviors you'd like to improve? That makes it a lot easier. Yes. Noise phobia, separation anxiety, leash aggression, excessive barking. Then we can intervene. So every time we should be asking that and realize that that's, behavior is medicine. Fear-free and training make better medicine. So the pet is better physically and the pet is better emotionally. I think back to 2009 when I first had this awakening on fear-free, and Karen Overall talked about we were causing repeat severe psychological damage to pets by what we were doing or not doing. I didn't really realize at the time how important training was to give them the kind of manners that integrate them within the home and don't lead to relinquishment or abandonment or being put outside the house into the backyard or made an outdoor only cat. I also remember back in 1980 when I graduated from veterinary school at Washington State University, we had been taught that animals didn't feel pain, with a caveat: if they feel pain, it's good because they'll be immobile. Oh, the folly of that, to think back there almost 40 years ago, how we were taught that. Of course animals feel pain, and now in the last decade we've embraced multimodal pain management. And that's really what we're talking about here. It's high quality medicine, it's fear-free, it's working with a trainer, and if necessary referring to a board of veterinary behaviorists. It's a multimodal method for emotional well-being. And certainly in America, we're not the first in the world. In fact, in Australia, 75% of practices hold puppy kindergarten classes in the practice, and most have really good working relationships with top trainers. I'll give you an example of how this is played out in the United States. One of the almost 80 boarded veterinary behaviorists in the United States, Teresa DePorter from the Detroit area, was working with a very successful hospital in Detroit, a huge hospital with lots of specialists, very busy. Got a lot of, not most of the pets that were adopted from a nearby shelter. She talked to them about doing fear-free. She talked to them about using a positive reward-based trainer, one of those people of the groups that we recommend. Nah, they liked adversive training. They liked the dominance, pack theory kind of training. In fact, ready for this, Mikkel? They were doing rollovers, alpha rollovers in the back of the veterinary hospitals to the puppies that they saw. It makes us cringe to even think about that. So she couldn't talk it into it, but she did talk to them about doing a study, which they agreed to. So pets that were adopted at the shelter that went to this practice where they were doing alpha rollovers, where they were referring to adversive trainers. I'll shorten this, but at the end of 2 years, just a little over 30% of those pets were still in the home. The best had been abandoned, relinquished, or euthanized. Think about that. You lost almost over two-thirds of the pets that came in that were already removed from the home and no longer clients. We mentioned earlier in there about losing 15% of your clientele due to behavior problems. Imagine losing, two-thirds of new clients because of behavioral issues. So now we got the attention of the veterinary hospital, and they agreed to look at positive reward-based trainers and also to embrace fear-free. At the end of the next 2 years, over 90% of those pets were still in the home. So it really points out, by working on physical and emotional well-being, doing an allied part of emotional health care by involving with a trainer, and if needed, a behaviorist, we can truly do well by doing good.